Irbesartan, commonly known as Avapro, is a medication used to treat high blood pressure and to help protect the kidneys from damage due to diabetes. By lowering high blood pressure, Avapro helps to prevent strokes, heart attacks, and kidney problems. It belongs to a class of drugs called angiotensin receptor blockers, ARBs, and works by relaxing blood vessels so that blood can flow more easily. The usual starting dose of Avapro for high blood pressure is 150 milligrams once a day. Your doctor may increase your dose to a maximum of 300 milligrams once a day. It's best to take Avapro at the same time each day, and it can be taken with or without food. It's important to take Avapro regularly to get the most benefit from it. Remember to take it at the same time each day. If you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose and resume your usual dosing schedule. Do not double the dose to catch up. You should take Avapro by mouth, either with or without food, as prescribed by your doctor. Typically, you'll take it once a day. The dosage will depend on your specific medical condition and how you respond to the treatment. It's important to take this medication regularly to get the most benefit from it. Try to take it at the same time every day to help you remember. Even if you start feeling better, keep taking Avapro. Many people with high blood pressure don't actually feel sick. If you don't notice any improvement in your condition, or if it gets worse, for example, if your blood pressure readings go up, be sure to tell your doctor. As your body gets used to Avapro, you may experience dizziness, lightheadedness, or upset stomach. If these effects persist or worsen, inform your doctor or pharmacist right away. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. Your doctor has prescribed this medication because the benefits outweigh the potential side effects. However, if you experience any serious side effects such as fainting or symptoms of high potassium blood level, it's important to notify your doctor immediately. Irbesartan, the active ingredient in Avapro, may be used to prevent or treat kidney problems, but it can also rarely cause serious kidney issues. Your doctor will monitor your kidney function while you are taking Avapro, so be sure to report any signs of kidney problems, such as changes in the amount of urine. Although rare, a serious allergic reaction to Avapro is possible. Seek medical help right away if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And remember, it's important to follow your doctor's instructions and not adjust your dosage without consulting them first. If you are pregnant or planning to become pregnant, it is important to avoid taking Avapro as it can cause harm to an unborn baby. It is important to use reliable forms of birth control while taking this medication to prevent pregnancy. If you are unsure about your pregnancy status, it is important to contact your doctor immediately. Before taking Avapro, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to Irbesartan. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. Also, be sure to let your doctor or pharmacist know about your medical history, especially if you have liver disease, dehydration, or high levels of potassium in your blood before using Avapro. Avapro may cause dizziness, and consuming alcohol or marijuana can intensify this effect. It's important to avoid driving, using machinery, or any activities that require alertness until you know how this medication affects you. Limiting alcoholic beverages is also recommended. If you are using marijuana, it's important to talk to your doctor about it. Additionally, this medication may increase your potassium levels. Before using potassium supplements or salt substitutes containing potassium, it's essential to consult your doctor or pharmacist. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's crucial to inform your doctor. It's not recommended to become pregnant while using Avapro, as it may harm an unborn baby. If you do become pregnant, discuss the risks and benefits of this medication with your doctor immediately. The effects of this drug on breast milk are unknown, so consulting your doctor before breastfeeding is advisable. It's important to be aware of potential interactions with other medications while taking Avapro. These interactions can affect how Avapro works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Avapro include aliskiren, lithium, and drugs that may increase the level of potassium in the blood. Additionally, some products have ingredients that could raise your blood pressure or worsen your heart failure. It's important to tell your pharmacist what products you are using and ask how to use them safely. This includes cough and cold products, diet aids, or NSAIDs such as ibuprofen or naproxen. Keep in mind that this is not an exhaustive list of potential interactions, so it's important to communicate with your healthcare provider about all the products you are using. If someone has taken too much Avapro and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe dizziness and fainting. It's important not to share Avapro with others. In addition to taking this medication, making lifestyle changes such as reducing stress, exercising, and adjusting your diet can help increase its effectiveness. It's important to talk to your doctor or pharmacist about making these changes. While taking Avapro, you may need to have lab or medical tests done to monitor your kidney function and potassium levels. Make sure to keep all your medical and lab appointments and consult your doctor for more details. It's also important to regularly check your blood pressure while taking Avapro and learn how to monitor it yourself. Be sure to share the results with your doctor. If you forget to take a dose of Avapro, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. When storing Avapro, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a safe place where children and pets can't reach it. When it comes to disposing of the medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult with your pharmacist or local waste disposal company on the proper way to discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.